Hi, my name is Davison, and this is Regothus, and this is Jonathan.
Hi, so today we're going to be talking about the Ebola hearing that is happening in the U.S. right now. Basically, the CDC and Congress are talking.
Yeah, so we want to respond actually point by point to something I found on Breitbart.com, the live tweeting of the Ebola hearing, because we can't watch it for whatever reason. I don't believe it's being streamed live. So we're going to go through point by point, so this might be a long video, but my belief is, and I've said this in a previous video, that we should ban travel from Africa until, especially West Africa, until the Ebola crisis subsides. Are you now starting to agree with me more than you did before? Because he was saying that it wasn't quite necessary, and I argued that it was, and people are going to regret not doing it sooner.
Well, I guess the countries that have it, the ones that don't.
But so back to me saying West Africa as opposed to all of Africa, but there's some argument for almost all of Africa at this point. Seeing as now, look, the one traveler managed to infect the nurse, actually two nurses, if not one of the nurses' boyfriends on top of that, and then one of those nurses went on a plane because she had to do wedding stuff, and she had a fever, so she was contagious at this point. So let's go through these points. So the first one is that 12:08 p.m., committee chairman, Republican Rep. Tim Murphy opened the hearing and is not buying the nonsensical argument that a travel ban is an all-or-one situation. We can ban travel from Ebola-affected countries and still get medical personnel in and out. Okay, well, I have a tendency to agree with that. What do you think?
Yeah, that makes sense. Obviously, yeah, they have to make exceptions for aid and stuff, but, like, that's not.
But civilian travel should be done with, over with, bye-bye.
Yeah.
See you in a year when this gets under control.
Yeah, pretty much.
Or 2 years. Unfortunately, this might be a 2-year thing at this point. So 12:11, Deanne DeGret repeated the absurd lie that an agency with $7 billion would have found an Ebola cure by now were it not for a small sequester cut.
Oh, yeah. Basically, a lot of politicians are, like, using this as a way to be like, you should be spending more money on this thing. And like, they're turning it into another type of political issue.
Well, they're turning it into a financial issue or a budgetary issue.
Yeah, but putting more money, had the CDC had more money, that wouldn't necessarily mean they'd have an Ebola cure. They probably wouldn't have been researching one before now because they would have no interest in it.
Well, that's just the thing, is that there was no interest prior to this crisis, precisely because, unfortunately, American nationals, or fortunately, American nationals were not affected.
But also,
but there have been research companies that have been working on cures, specifically a Canadian company, for years. But continue.
But even in Africa, I mean, usually it was only like a couple small communities that would get it, and then it would go away because it wouldn't spread, because it has such a high mortality rate that, I mean, if it kills everyone, then no one's going to spread it to anyone. But unfortunately, it just happened to infect people who were traveling this time.
And also, the spread might be in part promoted by the fact that the virus mutated slightly to make it more transmissible, because there's not just one strain of Ebola virus. There's several. And this one is especially virulent. It was, at the beginning of the crisis, it was a 50% mortality rate. Now they're saying it's a 70% one. So Rep. Diana DeGette came out and said that she's strongly against travel restrictions between the U.S. and African nations where the deadly virus is spreading rapidly, saying it could deeply harm Africa. The best way to stop this Ebola is going to be to stop the virus in Africa. Experts with Doctors Without Borders have told us that quarantine on travel would have, quote, a catastrophic impacts on West Africa. So what do you think about that?
I don't entirely see how that would have catastrophic. Well, okay, maybe it would have some impact on Africa, but like...
Well, their economy is already, let's be honest, in certain nations, catastrophic.
Yeah. Well, the thing is, it's a travel ban. It's not a ban on goods and services being shipped, imports or exports.
I would say exports maybe to a certain degree, but imports...
It depends. I mean, it depends what it is, right? And there's also the fact that if it's not known, does the disease still stay alive without a host for a certain amount of time? That has to be examined for imports to exports. But as long as you're letting in medical personnel and aid workers and all of these other people, then you're good. You're fine. That's perfect. But don't let random people go there.
No, and the people don't need to travel. I do not personally need to travel. Most people in their daily lives do not need to travel to other places. It's a luxury. We assume this luxury is a right given the affordability despite the rising cost of air travel, and we shouldn't. It's not necessary, and therefore, I mean, if anything, this Ebola crisis might eventually help the economy in Africa in that it's drawing more attention to just how horrible the situation is there.
Well,
and now that we're providing more aid,
and
even though it's terrible that it took this, things might eventually improve. And as long as we're still sending them resources, then the travel ban is not going to affect them adversely.
No. And I mean, as long as we are helping them like create more clinics and that sort of thing, which is what they desperately need, yeah, and we're good. They also need more education on the matter too, because a lot of people are scared and being like, people are getting kidnapped. But no, people aren't being kidnapped. They're just being quarantined. I mean, it's sort of the same, but not quite.
Okay, so...
Next point.
Next point.
Okay, basically, they bring in witnesses. People are saying it's not easy to stop Ebola.
Yeah, Democrats have already politicized the hearing with coordinated talking points, like we said before, about the need to give the CDC more money. Thus far, every Democrat who has spoken has pretended the CDC's budget was cut and argued that it would be well if we agreed to grow the size of government. Never let a crisis goes to waste lives on. This is very well. This website that we're reading obviously is a conservative blog.
Mind you, the same happens whenever there's any sort of big event or emergency situation. Either side of any political party is going to try to use it to their advantage.
Yeah, absolutely.
Because it's just what's in the news right now. It's what has people's attention. It makes sense.
Well, there's always chronic medical underfunding in all governments. You could never put enough money towards it because there's always new diseases that need to be, cured. So moving on to the larger point. So Bradley, it hammers the Obama administration. Now, this is a big point. Obama apparently said he would be comfortable kissing and hugging nurses who had treated Ebola patients, which I just think is stupid. I've supported Obama on a lot of things, but sometimes I'm like, you're being ridiculous. Like, why put forth this stoic front of everything's going to be okay, don't panic? That was my Obama impersonation. When really, no, there really is cause for concern, and I wouldn't be comfortable hugging and kissing them, and hopefully Obama doesn't come down with Ebola. Could you imagine?
Oh, God.
Could you imagine? Then he would eat his own words, and that would skyrocket it into the biggest crisis, the biggest medical crisis of the 21st century. But why is Obama? Why is Obama saying everything's hunky-dory, we shouldn't restrict travel, let's not panic, let's not panic?
In a way, you don't want people panicking here until there's a reason. You don't want people panicking even when there is a huge crisis, because panicking leads to people making irrational decisions.
Hoarding, rioting.
Exactly. So even if things are awful,
violence.
Even if there's a zombie apocalypse, the good thing to do is not to panic, actually. Because by panicking, you're going to fuck everything up.
Yeah, okay. So I just think that Obama, if you're listening to this, take Ebola more seriously. Ban travel from West Africa.
Yeah, not necessarily. It's like,
speed
don't
up
panic,
the availability
but still do something.
Of plasma from people who have survived Ebola, because that helps them fight off the virus. Also, fast track, as you've been doing, the vaccine against Ebola. So, next thing. Via video testimony, Dallas Hospital Director Dr. Daniel Varga admitted to making mistakes in handling the Ebola patient, the now deceased Thomas Duncan, and defended the hospital against charges of racism. Well,
okay,
racism. It's more like Ebola-ism, and can you blame people?
Yeah, pretty much.
And I mean that it was the moment you allow travel from West Africa or people who've been there, more and more cases are going to appear in the United States and Canada and any other country they end up in. This was inevitable, and of course hospitals aren't prepared because partially I will go back to the Obama administration telling everyone that everything's going to be okay when clearly it is not going to be okay. You can't think the Ebola virus out of existence, or you can't think the virulence out of the Ebola virus.
No, you have to do something. You can't just pretend it's going to go away.
So, under questioning, Rep. Fred Upton admits that up to 150 travelers a day are coming to America from African hot zones. Frieden claims that right now we know who's coming in. A travel ban might mean that they come here overland through porous borders. Okay, yeah, we wouldn't be able to stop them, but I will argue that, okay, that still, banning travel will greatly reduce those numbers.
Yeah.
So 150
people might find
a day,
alternate routes.
A day. And how many people are those 150 people in contact with on a plane a day, over a week, over a month?
Yeah, a lot.
An awful lot. And now they're saying that 10,000 new cases of Ebola are happening. I don't want to quote the wrong stat, but it was something like...
Well, it said they could go up to a shit ton of cases a week soon. And as you know, with viruses, things go exponentially faster. So that's the issue. You want to get rid of it before that graph goes up.
It's already gone up, and now
it's gone up, but it's not unstoppable at this point.
So now we're talking about we talked about the travel ban. We talked about the number of travelers. Now let's talk about the nurses that are infected. What they're saying is that one nurse that she traveled with a low fever. It's also possible in 13% of patients that they don't present with a fever despite being contagious with Ebola. That said, should all people who treat people with Ebola also be under mandatory quarantine? I'm starting to think the answer is yes.
Yeah, no, it would make sense. I mean, maybe have it a little bit less strict, but I mean...
What do you mean by a little bit less strict?
I mean, they're obviously taking precautions. If you're in a hazmat suit, you're not.
These nurses were in hazmat suits, though, but because they're not used to putting them on, there were breaches that they couldn't control. So I still think
they
that
are high
learning
risk.
curve,
they are high risk individuals.
Yeah, and that learning curve is going to apply at any hospital. It's not exclusive to Dallas.
No, exactly. So it's a matter of, well, they have to train these people properly before they even touch these patients, for one, and there should be someone observing these people as they're doing all of these things, if they're not already doing that. Because
a more highly trained, specialized person, i.e., e.g., military personnel.
Well, yeah, or something. I don't know who's in charge of making sure people put on hazmat suits
properly.
properly. But
scientists that are used to dealing with biohazardous material, one of them should be present. And yes, there are military agencies that study biological weapons and whatnot, and they do don protective suits, and they should train these people and be present whenever possible, not whenever possible, at all costs. I don't want to be wishy-washy about this. I think a lot of this crisis has to do with people being wishy-washy. I mean, I also have likened this to HIV. If you knew someone you were about to have sex with had HIV, would you say, well, I can't really get it if I kiss them, and I can't really get it if... I probably won't get it if I give them unprotected oral sex. No, you would take every precaution.
You go to the doctor.
You would make sure that they were on antivirals. You would take antiviral prophylaxis medication yourself, maybe, if you love this person.
Yeah. You'd take all the precautions that you knew about, that you could take. You would be super vigilant about it. Which is why, when you have one partner that has HIV, and they both know about it, often the other one doesn't get it.
Because
in fact,
of
the incidence of
abundance of caution. So why aren't people doing that with Ebola?
Yeah.
And Ebola, by the way, is also sexually transmitted. It can stay in the semen of men up to, I believe, a month after they've been infected. Okay, so this is the final...
Mind you, if you know someone's had Ebola, you probably shouldn't be having sex with them.
Yes, definitely not. So finally, can a person without a fever transmit Ebola? The federal government denies it, but Representative Tim Murphy is not sure. What were you going to say?
Well, that's kind of hard to tell. It's like, okay, at what point is it a fever? Some people have lower body temperatures than other people. It's variable.
Oh,
You're talking about biology. We're not talking about machines here. So, to say this threshold of temperature means that you're contagious is no, that's dumb. Like, you can still have a certain degree of the virus in you. Like, you can still have some of it. It's not necessarily dead. It's maybe not as contagious, but it's still there.
Well, I mean, I know that I have a fever at 99, and my fever point is lower. So if they were testing me, their restriction is at 100 Fahrenheit. So I would pass, and then I would potentially pass it on to a lot of people, and that's terrifying. And I wanted to say that Murphy was puzzled that the administration still refuses to consider any travel restrictions from 1,000 travelers entering the United States each week from Ebola hot zones. He said America should not put the concerns of fledgling democracies over protecting public health, and emphasized that we do not have to leave the door open to all travel to and from all hot zones from Western Africa, while Ebola is an unwelcome and dangerous stowaway on these flights.
Yeah, pretty much.
So we're essentially ending where we're beginning, which is take Ebola seriously, ban travel from West Africa, speed up the available available cures such as plasma, and make the vaccine widely available, and send more aid to Africa, and send more aid to the hospitals here. So the final point that we're on right now, because it's now 1:54 p.m. Okay, they're talking about the CDC budget again increasing. And then they're also talking about tracking people that come in, but tracking the people that come in is already too late. It's already too late. They're already infecting people.
Yeah. What's the point in tracking them if they're here? It's like all that does is that if they end up having it, then it's too late because everybody who they've been around has it. And then, have you been tracking those people? No. That's a lot of people to track.
Well, this has been Regote This. We have been talking about the Ebola hearing. Let us know your thoughts on Ebola hearing down below in the comment section. We welcome your arguments for why we shouldn't ban travel, and any stories about people. Maybe
because we're not sure
who's been affected directly by the Ebola crisis.
Yeah, we're not sure what the benefit /
I'm sure
bad things are for it.
Well, I'm sure. We're
pretty sure, but we don't know. We're not political scientists.
Well, but I believe that I have some pretty intelligent opinions about this and in general, and I'm a reasonable person with a medical background. So I think an excess or abundance of caution is necessary. First, do no harm, and that would be that. So my name is Davison, this is Jonathan, and this has been Regote This, talking about Ebola. I hope things get better.